I'm Dr. Rita McGuire. I'm the Chief Medical Officer here at Wakana, one of the co-founders, and I'm an obstetrician gynecologist of over 30 years. A little bit more about myself. I trained at Wayne State School of Medicine. I completed my residency right here in Chicago at Cook County Hospital. I'm also CEO of RJM Wellness and Ripped Rita Fitness. I'm a global women's health and wellness speaker. I'm also one of the certifying physicians for the medical marijuana program here in the state of Illinois, as well as a member for Doctors for Cannabis Regulation. So I want to welcome all of you this evening. We are on Facebook Live. We're here on the Zoom webinar. Every Wednesday evening, I pick a topic of interest, and then we talk about how that specific topic can be utilized, or CBD can be utilized to assist with that condition. So tonight, we are going to talk about gout. I've been getting a lot of requests as it relates to gout. Let's first talk about what gout is. Many of you may know someone who has gout, or maybe you've heard of gout, or maybe you yourself have gout, but it is a form of arthritis. And when I'm telling you it is severe pain, it is right up there with labor pains, okay? It causes a lot of redness, a lot of swelling and tenderness, specifically in joints, in the big toe, in the knees, in the ankles. And it is the result of too much uric acid. So uric acid is a compound that can start to increase in our body, especially when we are overweight, or maybe we are eating a diet high in purines. Purines are the precursors to uric acid. And when it builds up in joints, it can cause a lot of pain. It can cause a lot of inflammation, and it can cause a lot of issues with quality of life. In fact, a lot of my patients who suffer from gout, they talk about how it's almost impossible for them to put a shoe on, for them to put a sock on. I mean, any sort of pressure in that area of the joint can cause severe, severe pain. Now, these attacks can be short-lived. They can be on weeks in. They can cause a lot of discomfort. And then what's very interesting is that there's stages of gout. So it progresses from stage 1 when you start to have that uric acid building up in the blood. And then it starts to form crystals in the joints, or deposits around the joints. Then stage 2 is when one has an acute attack, causing a very, very painful gout attack. And then stage 3 could be periods of remission in between gouts. That's called gout flares, where those attacks are intermittent. And then stage 4, or chronic gout, is when there is frequent attacks, and we call something called tophi that start to form in the joint. So you can see that gout is an inflammatory process. It's a form of arthritis, and it's extremely painful. So what are some of the treatments for gout? Now you know what gout is. It results from high uric acids in the blood, and it builds up in joints. But some treatment that we have, we speak about holistic or natural remedies, is diet. Many people who are overweight, that is a risk factor for gout. So losing weight, following a low purine diet. In fact, a low purine diet means that you're removing red meat, you're removing alcohol. There are certain shellfish, seafood that should be eliminated from your diet. There are certain vegetables you should be eating. You should be eliminating sugar. So any food that's high in purines, which is a precursor to uric acid, should be eliminated from your diet. Exercise. I can't stress enough, diet and exercise is really the key to attacking and addressing challenges in your life, even when it is gout. So exercising, making sure that if you have very painful and swollen joints, that you're doing some exercises that are in the water. Aqua aerobics is really good. Yoga, Pilates, these sort of exercises can also help to strengthen the area around those painful and inflamed joints. Hydration, drinking water. Water helps to flush out the uric acid. Water also helps to reduce the risk of kidney stones because folks who have gout are predisposed to kidney stones because of the crystals of the uric acid can not only build up in the joints, but they can also build up in the kidneys. So drinking lots of water. In fact, cherry juice or apple cider vinegar. Those are two really great home remedies that the vitamin C in the cherry juice helps to reduce the uric acid levels. Medications like colchicine or allopurinol, those are the most common medications that we use for gout. There's anti-inflammatories that may be recommended, like naproxen or Advil or ibuprofen, and then colchicine, and then steroids. Sometimes you may be offered a steroid injection or prednisone. And then there's cannabis, CBD. And that's what we're going to talk about tonight, that CBD, yes, can be a tool that one can use as a holistic natural option for assisting in those very painful symptoms that gout can cause. So let's talk about the cannabis plant. When we hear the word cannabis, we often have a negative stigma, right? We think about marijuana and being high and having paranoia, having the munchies, having a euphoria. But it's important that you understand that cannabis has two species. One species does give you the high and the euphoria and the paranoia. That's called marijuana. It has high levels of delta-9 THC, and this is why it gives you the high. But then there's another species. It's called hemp. And hemp, unlike marijuana, has very trace amounts of delta-9 THC and high amounts of CBD or cannabidiol. And this is why hemp gives you the health without the high. So it's giving you the same benefits that you may be looking for, i.e. reduction of inflammation, reduction of pain, helping one address depression and anxiety, but it does all that without the high. So two species under one family, the cannabis plant. Tonight, we're going to concentrate on the hemp species. We're going to be really learning a lot about CBD or cannabidiol that is sourced from the hemp plant. Again, the difference between CBD and THC. Quite honestly, it's real simple. The THC gives you the high and the CBD gives you the health. So there is no euphoria or paranoia with CBD. There is with THC. And then there's also other ways that we can utilize CBD that's sourced from hemp, not only for its therapeutic and some medicinal benefits, but for industrial uses. We're seeing a lot of clothes, homes being made from the hemp species. So CBD or cannabidiol has a long list of medicinal benefits to the body. In fact, there are over 25,000 peer-reviewed articles to date that really helps you understand that CBD is a very powerful anti-inflammatory. But let's look here in the slide. It's an antibacterial. It inhibits cancer cell growth. And that's why we're seeing so many oncology patients or oncologists utilizing CBD, not only for that reason, but because it addresses and reduces nausea and vomiting. So for patients who are undergoing cancer treatment. CBD is neuroprotective, so it's helping to protect nerves that may have been damaged from strokes. It may have been damaged due to nerve trauma, neuropathy, sciatica, a lot of conditions that nerve damage happens. CBD can come and help to restore those nerves. CBD also promotes bone growth. It reduces seizures and convulsions. In fact, we see CBD and its mainstream in 2013, 2014, when a little girl by the name of Charlotte Fiji, her mom and dad had exhausted every single treatment there was for her disorder. It's called Derived syndrome. This is when children have seizures disorders and they have between 300 and 500 seizures a week. It wasn't until her family introduced her to CBD cannabis, this little girl, Charlotte Fiji, went from 300 seizures a week to 3. So CBD also helps to reduce inflammation. And this is key when we're speaking about gout, because gout is an inflammatory sort of arthritis. CBD helps to reduce pain. It helps to reduce anxiety. It helps to address sleep disorders like insomnia. It helps to treat skin disorders like psoriasis and eczema and acne, and is also vasorelaxant. So it helps to improve the blood flow in blood vessels. It helps to improve blood flow to very important organs like the penis and erectile dysfunction. We see improvement in those who have high blood pressure, that the constriction of those vessels are now being improved with CBD. But then there are other cannabinoids or compounds that the plant makes, like CBG and CBC and delta-8 THC and THCV. These are all the main cannabinoids that the plant makes that synergistically on a cellular level works with CBD to give the body relief. Now, the plant makes over 140, 150 now compounds, but these are the main compounds or cannabinoids that you should know about. The next question you may have is CBD legal? Well, in 2018, the Farm Bill was passed. Now, this bill is an agricultural bill, but it also removed hemp from the Schedule I drug listing. So hemp, for decades, has been a Schedule I drug, right up there with LSD and cocaine and heroin. But in 2018, it was removed. So now CBD that's sourced from hemp, CBD sourced from hemp, containing less than 0.3% of THC, is now legal in all 50 states. Legal not only to consume, but to cultivate, grow, and to sell. So how does CBD work, or how does cannabis work? How do all of these cannabinoids work in our body? Well, it is a science behind how it works. So CBD is not a magical potion. It's not a snake oil. It's not some derived potion that we discovered yesterday. But CBD works through a physiological system called the endocannabinoid system. Now, this system was discovered when I was in medical school. I'm dating myself, but in the early 1990s, this system was deemed the most vital regulatory body system in our body. So it's more important to than the musculoskeletal system, the endocrine, the circulatory system, the nervous system. And what's very sad is less than 8% or 9% of medical schools or other healthcare professional schools like dental schools and nursing schools are teaching students about the endocannabinoid system. The system is made up of receptors, and these receptors are found throughout our entire body, from our head to our toe. These receptors are looking for THC and CBD and CBN and CBC and CBG and delta 8 THC to put our body into balance, to put our body into homeostasis. And when these cannabinoids bind with these receptors, the main receptors are CB1 and CB2. They're found in our heart, our lungs, our liver, our kidneys, our skin, our teeth, our stomach. They're found in every organ and gland in our body. When they bind to these major receptors, they send a signal to different areas of the body that need balance, or they send signals to different areas of the body that needs relaxation or sleep or reduction in inflammation or reduction in blood sugar levels. So this system, this endocannabinoid system regulates our mood, it regulates our wake-sleep cycle, it regulates our metabolism, our heart rate, our blood pressure. It is the most vital regulatory system in our body. So that's the science. Now, our body, just like the plant, produces cannabinoids as well. They're called endogenous or endocannabinoids. And you'll see them on the left. They're anandamide and 2-AG. Now, these two main endogenous cannabinoids work just like the cannabinoids that the plant makes. But what's really cool is that our body produces them. In fact, anandamide and 2-AG are both found in high levels in breast milk. So if you know any breastfed moms, you can let them know that they are giving their baby absolutely the best thing in the world. And those are endogenous cannabinoids that keep our body into balance. In fact, anandamide comes from a Sanskrit word, ananda, that means bliss. It means joy. And this is why so many breastfed babies are so happy, right? And so healthy. These endogenous cannabinoids are also found in dark chocolate. That's the reason why when you eat dark chocolate, you feel so good. And they're also found in high levels in beer hops. So endogenous cannabinoids are produced by our body. They're very important to have around to keep our body in balance. So when we talk about CBD as it relates to gout, there are many, many studies that show that CBD reduces the inflammation through many, many pathways. You know, there are different pathways and pain receptor pathways in our body. There are pathways in the central nervous system. There are pathways in the peripheral nervous system. But just know that CBD, number one benefit to the body is it reduces inflammation. CBD also reduces oxidative stress. See, oxidative stress is really bad on the body. It tears our body apart. Those free radicals come in and cause havoc. So with CBD and the receptors and the endocannabinoid system, CBD acts as an antioxidative, and it helps to reduce inflammation and pain as well. So when we look at CBD, you know, you can find CBD everywhere, right? There's CBD at gas stations. We see them at the smoke shop. We see them at the grocery store, at the health food store. But there are 5 main components you should know before buying a CBD product. Because see, not all CBD is made equally. There are many CBD companies that market their product in such a way that you think you're getting thousands of milligrams of CBD, and what you're getting is hemp seed oil. See, the seed of the hemp plant doesn't contain these cannabinoids. The seed of the hemp plant does contain very nutritious products like essential fatty acids and proteins, very nutritious for the body, but it's not going to give you the results that cannabinoids do. So when you're looking for a great product like we have here at Wakana, you want to ensure that the hemp, the plant, is grown in an organic fashion. See, hemp is a bioaccumulator, which means that if it is planted in soil that's not organic, it will accumulate whatever in the soil. It will accumulate toxins and heavy metals and pesticides. You want to also find out how the CBD is extracted. A very clean extraction method that we use here at Wakana is a supercritical CO2 extraction method. That's a very clean method. It is more of an expensive one, but the byproducts are very, very safe for the body. You also want to ensure that the products are third-party tested. This is critical. Now, the FDA does not require that of any CBD company that their products are tested, but here at Wakana, we test all of our products to ensure our products are of potency, that the potency that we have on the bottle is there, the fact that the product is free from mold, mildew, heavy metals, pesticides, residual solvents. All of this third-party testing is ensuring that our customers have a quality product and a safe product. So choosing a brand that stands behind that product is what we offer here at Wakana. So I'm going to read this disclaimer that the statements made regarding these products have not been evaluated by the Food and Drug Administration. The efficacy of these products has not been confirmed by FDA-approved research. These products are not intended to diagnose, treat, cure, or prevent any disease. All information presented here is not meant as a substitute or an alternative to information from your healthcare professional. Please consult with your healthcare professional about potential interactions or other possible complications before using any product. The Federal Food, Drug, and Cosmetic Act requires that I read this notice. So, third-party validation. We have partnered with Green Scientific Lab. They are the top ISO lab in Florida. South Florida, Davies is where they're located. I'm here working with the Chief Scientific Officer, Dr. Marsh, and their other leaders. This is an amazing lab. They have state-of-the-art equipment where all of our products are third-party validated and tested. Every single batch we test. Again, the certificates of analysis you'll find on all of our products. We have a very easy one-sheeter that shows you the potency of our products, also explains the fact that the testing for mold, mildew, heavy metals of all of the ingested products are there, and we have passed with flying colors. So dosing, how do you dose CBD? You know, how much do you take? Because it's not an FDA-approved medication like Motrin or Aleve or any other medication you may take that has a specific dosing requirement or recommendation. The Mayo Clinic did a study, and what they looked at is they looked at folks who had chronic pain, for example. They looked at people who had schizophrenia or glaucoma or loss of appetite, and they found a range for CBD on a daily dose that should be recommended. And what they found, which is very interesting to me, for chronic pain, something like gout, 2.5 to 20 milligrams of CBD with or without THC under the tongue a day. And that's not a lot of CBD. So when we talk about dosing, we always want you to start low and start slow. If you consume CBD too fast, you may have a side effect. You may have a little nausea. You may have a headache. You may have a little fatigue. So starting low and starting slow is a great way to start our CBD products. So our tinctures. Tinctures are products that you place underneath the tongue. The recommending dosing is starting with 3 drops under the tongue in the morning and 3 in the evening. It takes about 15 to 20 minutes for a tincture to get into the bloodstream. See, the tincture is absorbed by these glands underneath your tongue. They're called sublingual glands. And it's really important to hold the tincture under the tongue for a minute before you swallow. That way it ensures that the CBD is being absorbed, getting in the bloodstream, and helping to give you some relief. Now we have 2 lines of CBD tinctures or products. We have a power line, that's our full spectrum line. That is the product that's going to give you all of the components, the constituents, the cannabinoids that we talked about, along with the legal limit of THC, which is 0.3% or less. And then we have another formulation. That's our pure. That's our broad spectrum products. Those are products that if you have random drug screens, you want to use those products. Now, our tinctures come in different potency. We have a 500 milligram, we have a 300 milligram, and we have a 900 milligram tincture. So starting low still and going slow is a great way to start our tinctures. 3 drops twice a day. Now, we have a proprietary formula on our products. We have our 500 milligram powered hempranium that has CBD along with black seed and turmeric. Now, many of you've heard about turmeric, right? Turmeric is another essential oil that is recommended for those who have gout. Why? Because turmeric helps to reduce the inflammation. Black seed is the same way. It really does help reduce inflammation. It's an antioxidant and has many, many more benefits to the body. Now, topicals are another great product, especially when we're dealing with something like gout, a type of inflammatory arthritis. Topicals offer local relief. So taking our topicals, like our extreme pain cream, and really putting it in the area of concern, in the joint. I like using the Power Extreme Pain Cream at night. I work out every night or every day, and those muscles are sore at the end of the day, right? I like rubbing that in at night, this one here, so that it can really allow me sleep at night. Now, the Doctor's Rita's Rub is another form of our topical CBD. And what I love about the Dr. Rita's Rub is its versatility. It's in a roller ball, so you absolutely can carry it around in the event there is a gout flare or an acute attack of inflammation and swelling. We have other topical products. We have a body cream, body lotion. We have a facial serum, all infused and enhanced with CBD. And then our edibles. An edible is another way of consuming CBD. We've talked about tinctures, we've talked about topicals. Edibles come in the form of coffee, they come in the form of gummies. We have spices, we have a vegan butter, we have a culinary oil that you can bake and cook with. Just know that edibles take a little longer to get into the bloodstream. They take about 30 to 90 minutes. But again, they are addressing inflammation. They are addressing the inflammatory process that we see in those who have gout. And then our smokable products are a great way to offer very quick relief. When you use smokable products, they work within 1 to 5 minutes. So this is a great addition for those who have that acute gout flare. Our smokables come in pre-rolls, they come in vape cartridges, they also come in our premium flower for those who like to roll their own CBD joint. And then we talked about one of the risk factors. One of the risk factors for gout is obesity. So we have an entire weight loss line of products that start with our bitter detox. We move into our flat belly brew. It's a coffee. And did you know that coffee helps to reduce uric acid in the body? So you absolutely want to drink coffee if you have gout, because coffee, along with apple cider vinegar, along with cherry juice, these are definitely natural, holistic things you can do along with the CBD and along with the other diet modifications and exercise that you want to do to improve your symptoms. And then our flat belly gummies. Again, these gummies not only help to address inflammation, but they help reduce the cravings for carbs, the cravings for sugar. Remember, when you have gout, you should be on a low purine diet. So you shouldn't be eating red meat. You shouldn't be drinking alcohol. And absolutely, you should be away from shellfish and sugar. So these products help with that management of appetite, cravings for carbs and sugars, and detoxing at the same time. So a question you may have if you are on medication for gout, or maybe you know someone who has gout and is on medication, you want to share this information, is can CBD be taken with gout medication? Again, one of our most popular medications that folks are on is allopurinol. And CBD may decrease the excretion rate of allopurinol, which means there's a potential risk of allopurinol levels to be high. So if you are on medication for gout, if you're under a doctor's care, just let your physician know that you want to use CBD. Your doctor can very simply reduce that dose of allopurinol. We don't want you to reduce that dose of allopurinol. We don't want you managing your medication. We want you and your doctor to work together so you can use CBD, which is another tool, as I call it, in the toolbox for overall wellness. So this is a great starting point for those who have gout and they want to use our amazing Wakana products to assist with symptoms of gout. We talked about coffee. Coffee will not only help to reduce your weight, but it will also reduce the uric acid in the body. Gummies, either the pure gummies, if you have random drug screens at your job, or the power gummies, are great to help you sleep and reduce inflammation. The topical products, either the Power Extreme Pain Cream or the Dr. Rita's Rub, or both can be used. And then, of course, our powered hempranium. I really love the powered hempranium in this situation because our powered hempranium has turmeric, it has the black seed, it has the CBD. So this is a proprietary formula that has enhanced the CBD so that it can reduce the inflammation and swelling in those who have gout. So thank you so much. This has been a wonderful, wonderful topic. I've had several people to reach out to me and ask me to do a topic and a webinar on gout. So hopefully now you understand what CBD is, how it works in the body, the endocannabinoid system, and how we can utilize CBD, not only in assisting with symptoms in gout, but many, many other challenges that you or your family and friends may have. Now, you can reach out to me at any time. My email is listed here It's ritamd@wakana.com. Again, that's ritamd@wakana.com. I'm going to entertain some questions now. I'm going to stop sharing my screen here. I see Dr. Betty is on. If there's any questions, you can put it right there in the chat, or you can put it in the Q&A box, but we'll take about 5 minutes and then we will call it a night. I know everyone is in the kitchen and they are preparing for tomorrow. Thank you so much. I see a happy Thanksgiving, Dr. Rita. Thank you. Happy Thanksgiving to you. Someone is asking about having a stent in their leg. And Valerie Jackson, if you can be more specific, because I'm not sure what you're asking. How are you doing, Dr. Betty?
I am excellent. How about yourself?
I am excellent as well.
Good, good. Well, I just wanted to make a quick share a bit of information. I know the purines, red meat, and those kinds of things contribute greatly to the production of uric acid, which promotes gout. But also, I found out that so does high fructose corn syrup. Ooh. And, you know, they put that in everything. So I would really like to encourage everyone to pay attention to the labeling on the foods and the drinks, especially that you utilize, because like I said, they really do put high fructose corn syrup in a multitude of products. And so what prompted me to this discovery was that when I was doing nursing, home health nursing, I had patients who had gout. And they were taking allopurinol, and they would still have these flare-ups, and they would swear that they weren't eating red meat. And I could not understand why they were having these flare-ups. And I literally stumbled upon this discovery. But yes, high fructose corn syrup does contribute to the promotion of high levels of uric acid. And in addition, so it's a good idea to read the labels as well as minimize the amount of fruity juices that you're taking in, because fruit juices are high in fructose, which is a natural fruit sugar, but at higher levels, this also contributes to inflammation, which is, again, a great contributor to gout. That's all for me.
Well, thank you so much. That is some really great nuggets that you shared. Bottom line is diet, exercise is always the common denominator in changing the trajectory of our health. And as Dr. Betty said, there are so many different forms of sugar. Sugar, along with red meat and alcohol, worsens gout. You want to stay away from that. So following a low purine diet, making sure that you are drinking lots of water, and you're just staying away from all of those high sugary fruit juices and other sorts of food. So thank you, Dr. Betty. Really good stuff. Great testimony on a patient who was on allopurinol and still having those gouty flares. So we want to really share this information with so many people that we know and love that may suffer from gout. So there are some questions about blood clots in the leg and pain. So we have to always remember the disclaimer. The FDA does not allow us to make claims that CBD can cure anything, right? But what we can do is that when we have a condition like a blood clot in a leg, and that leg, because of the clot, is in a lot of pain, it's a lot of swelling. Yes, we can utilize CBD. We can utilize a topical to help relieve and to assist with some of those symptoms that a blood clot may have. We can't make any claims that it's going to cure that blood clot, but absolutely can assist with symptoms. The same thing holds true when we talk about bipolar. We talk about depression. We talk about anxiety. The science behind how CBD improves those conditions is that it helps to release serotonin and dopamine from those receptors in the central nervous system so that dopamine and serotonin can help to improve mood. So there's a lot of research that really does show that CBD can assist with symptoms that actually help to improve mood disorders, depression, anxiety, panic disorders, etc. It all comes down to the science of the endocannabinoid system and these receptors and these pathways. Wonderful. So we are going to call it a night. If you have additional questions, please email me at ritamd@wakana.com. That's ritamd@wakana.com. There are lots of questions that are in the chat, but they're not specific. So if you email me, and let's get a little bit more specific and not so general, I absolutely will respond this evening. So ritamd@wakana.com. I want to wish everyone a wonderful holiday tomorrow. Be well, be safe, enjoy your family safely. Make sure that everyone is washing their hands and making sure that everyone is having a very, very safe and a very prosperous day tomorrow. So we'll see you next week. You can also email me and let me know what topic you want to hear, but we are really getting all these topics out of the way and so happy to add on gout for this evening. So be well, be safe, and we'll see you next week. Thank you, Dr. Betty.
Thank you. Happy holidays.
Happy holidays.
Thanksgiving.